The coronavirus swept through northern Italy, killing thousands of people, but crucially infecting thousands of medical staff, doctors and nurses as well. I travelled to one hospital in the south of the country, in Naples, where they're taking extreme measures to protect their medical staff. And so far, not one of them has become infected. This is a whole different... There's a rush on here. The patient inside is deteriorating fast. A nurse prepares an injection outside the treatment room. He never goes inside, communicating through windows to colleagues with the patient. And they never come outside during crisis moments. And this is one. When it's ready, the medicine is passed through a compartment door. Remember, he's not been inside and hasn't touched anyone or anything. But he immediately removes his gloves and scrubs down. This is an absolute constant.
Basically, it's a hospital trust that is dependent upon all of the hospitals working together, because the capacity is already pretty much full. And they just accept that if it gets worse, they'll just have to deal with it, but nobody's really sure how. And the numbers are rising, there's no doubt in that. And again, critically, they're getting younger. No doubt about it. Here they're saying it doesn't make any difference if you're young or you're old, you're going to get it.
The lag between the epidemic sweeping through northern Italy and overwhelming the healthcare system there before progressing to the south gave this hospital precious time to prepare. It is the exception in the south. It was already the most advanced hospital. What is really striking here is that the rules of separating infected environments and the clean areas are followed by everyone. But armed security man every connecting corridor in case anyone forgets. We're moved back and the corridors locked down as a new patient is brought in. This happens every time. Preparation is the key to stopping the virus. Preparation and equipment.
Is that speed with which things were organised significant as a factor in controlling the disease?
Yes, yes.
If the hospital's organised, the treatment's better, is that right?
This is the first thing to do in this kind of hospital. It's Dr. Fiorentino now is organizing these two wards, and it's very, very important to separate the street and so on, to organize how dress and undress, how put a doctor or nurse in the room, how put your mask. It's very important.
And also, you have to have the right equipment to do it.
Yeah, we fight for, but however now we are.
This is a sub-intensive care unit. The patients are either recovering or haven't deteriorated yet. But the same separation rules apply. The red and white line cannot be crossed. Clean area nurses and doctors assist infected area staff across the line. They keep the two absolutely separate.
Because in other hospitals, they were together. It was too chaotic.
No,
you have to be
there
separate.
is a higher number of infection in the doctors, in the nurse.
Yeah, very high.
Yes. In this hospital, nothing.
Across the world, as the pandemic spreads, we're seeing the number of infected and dying jump every day. Health workers are right on the front line, and they're succumbing to the illness every day as well. Perhaps, though, it doesn't have to be inevitable. It isn't here. But they do have the kit. They don't just hope. But you have to remember, this is an exception, particularly in the south of the country. The hospital is a specialist infectious diseases facility. But it goes to show that basic separation and the proper equipment pays dividends for patients and the staff.
Hey, NBC News fans, thanks for checking out our YouTube channel. Subscribe by clicking on that button down here, and click on any of the videos over here to watch the latest interviews, show highlights, and digital exclusives. Thanks for watching.